On August 4th, 2023, the US FDA approved ZURZUVAE for adults with postpartum depression. ZURZUVAE is the first and only oral, once-daily 14-day treatment that can provide rapid improvements in depressive symptoms for women with PPD. Per the manufacturer, ZURZUVAE is expected to launch and be commercially available in the fourth quarter of 2023, shortly following the scheduling of ZURZUVAE as a controlled substance by the U.S. Drug Enforcement Administration. As part of the approval process, the FDA designated ZURZUVAE for priority review and fast-track review for the PPD indication. The information provided in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. First, a little bit on postpartum depression. There are three types of postpartum mood disorders. The first one, postpartum blues or baby blues as it's called, affect between 50 to 75% of people after delivery. If you're experiencing baby blues, you will have frequent prolonged bouts of crying for no apparent reason, sadness, or anxiety. The condition usually begins in the first week, usually between 1 to 4 days after delivery. Although the experience is unpleasant, the condition usually subsides within 2 weeks without treatment. The best thing you can do is find support and ask for help from your friends, family, or your partner, and of course speak to your healthcare provider. Next, postpartum depression is far more serious than baby blues, affecting about 1 in 7 new parents. If you've had postpartum depression before, your risk increases to 30% each pregnancy. You may experience alternating highs and lows, frequent crying, irritability, and fatigue, as well as feelings of guilt, anxiety, inability to care for your baby or yourself. Symptoms range from mild to severe and may appear within a week of delivery or gradually even up to a year later. Although symptoms can last several months, treatment with psychotherapy or antidepressants is very effective. Postpartum psychosis is an extremely severe form of postpartum depression and requires emergency medical attention. The condition is relatively rare, affecting only 1 in 1,000 people after delivery. The symptoms generally occur quickly after delivery and are severe, lasting for a few weeks to several months. Symptoms include severe agitation, confusion, feelings of hopelessness and shame, insomnia, paranoia, delusions or hallucinations, hyperactivity, rapid speech, or mania. Postpartum psychosis requires immediate medical attention since there is an increased risk of suicide and risk of harm to the baby. Treatment will usually include hospitalization, psychotherapy, and medication. Postpartum depression is common, as many as 75% of people experience baby blues after delivery. Up to 15% of these people will develop postpartum depression, and 1 in 1,000 people may develop postpartum psychosis. Speak to your healthcare provider about this condition, and if you're feeling or experiencing any of the symptoms. Causes include a combination of multiple genetic, physical, emotional, and social factors. PPD may occur in the other parent, for example, the father. They may feel sad, tired, overwhelmed, anxious, or have changes in their usual eating and sleeping patterns. PPD can last until 1 year after your child is born. Doesn't mean you will feel cured, but still speak to your healthcare provider during this period. Some of the risk factors for postpartum depression include previous history of depression, especially during pregnancy, poor social support, stressful life events, complications during pregnancy, single parent, low income, and young or adolescent mother. Symptoms of postpartum depression, as mentioned before, include any of the following: intense sadness, hopelessness, emptiness, depressive moods, disrupted sleep, reduced appetite, guilt, and in extreme situations, suicidal tendencies. Postpartum depression is treated differently depending on the type and severity of your symptoms. Treatment options include anti-anxiety or antidepressant medicines, such as selective serotonin reuptake inhibitors like sertraline, brand name Zoloft, or fluoxetine, brand name Prozac, or psychotherapy, such as talk therapy or cognitive behavioral therapy, and also support in group participation. Treatment for postpartum psychosis may include medication to treat depression and anxiety and psychosis. You may also be admitted to a treatment center for several days until you're stable. If you don't respond to this treatment, electroconvulsive therapy may also be given and it can be effective. If you are breastfeeding, don't assume that you can't take medicine for depression, anxiety, or even psychosis. Talk to your healthcare provider about your options. Now let's talk about ZURZUVAE. It's the first and only treatment approved specifically for postpartum depression. Some of the medications used right now for PPD have an indication for depression or major depressive disorders, but not specifically for postpartum depression. ZURZUVAE is a neuroactive steroid, GABA A receptor positive allosteric modulator. Thereby, it increases the effect of GABA. The GABA system is the major inhibitory signaling pathway of the brain and central nervous system and contributes to regulating brain function. It does have CNS depressant activities, which leads to the majority of its side effects. ZURZUVAE targets brain networks responsible for functions such as mood, arousal, behavior, and cognition. 2 studies conducted showed that depressive symptoms improved as early as on day 3 after starting ZURZUVAE and sustained through day 45. ZURZUVAE is a federally controlled substance because the active ingredient, zuranolone, can be abused or can lead to dependence. ZURZUVAE, as part of its approval, received FDA priority review and fast track designations. So let's talk about that. FDA priority review is a designation that will direct overall attention and resources to the evaluation of applications for drugs that, if approved, would be significant improvements in the safety or effectiveness of the treatment, diagnosis, or prevention of serious conditions when compared to standard applications. Significant improvement may be demonstrated by the following examples: evidence of increased effectiveness in treatment, prevention, or diagnosis of condition, elimination or substantial reduction of a treatment-limiting drug reaction, documented enhancement of patient compliance that is expected to lead to an improvement in serious outcomes, or evidence of safety and effectiveness in a new subpopulation. FDA decides on the review designation for every application that it sees. So in this situation, for ZURZUVAE, there was improvement seen by day 3 after starting ZURZUVAE, which is a significant improvement on what's currently available in the market. As for FDA Fast Track designation, Fast Track is a process designed to facilitate the development and expedite the review of drugs to treat serious conditions and fill an unmet medical need. The purpose is to get important new drugs to the patient earlier. Fast Track addresses a broad range of serious conditions. Filling an unmet medical need is defined as providing a therapy where none exists, or providing a therapy which may be potentially better than available therapy. Any drug being developed to treat or prevent a condition with no current therapy obviously is directed at an unmet need. If there are other therapies available, a fast-track drug must show some advantage over the available therapies, such as showing superior effectiveness, effect on serious outcomes, or improved effect on serious outcomes, avoiding serious side effects of an available therapy, improving the diagnosis of a serious condition where early diagnosis results in an improved outcome, decreasing a clinical significant toxicity of an available therapy that is common and causes discontinuation of treatment, ability to address emerging or anticipated public health need. As opposed to the priority review, fast track designation must be requested by the company for FDA to assess. Now let's summarize ZURZUVAE according to its product approval. As stated before, ZURZUVAE is indicated for the treatment of postpartum depression. It's administered with fat-containing food to increase its absorption. The recommended daily dose is 50 milligrams orally once daily in the evening for 14 days. The dosage may be reduced if the patient is experiencing CNS side effects. ZURZUVAE can be used alone or in an adjunct to oral antidepressant therapy. There is also dose adjustment for those patients who have either liver or kidney disease. There are no contraindications for ZURZUVAE. Some warnings and precautions include CNS depressant effects, specifically somnolence and confusion, and also suicidal thoughts and behavior, which can be experienced in many antidepressant medications. Embryo-fetal toxicity. This product may cause fetal harm. Advise a pregnant woman of the potential risk to an infant exposed to ZURZUVAE in utero. The most common side effects include drowsiness, dizziness, diarrhea, fatigue, nasopharyngitis, and urinary tract infection. Use of ZURZUVAE may cause suicidal thoughts and behavior. So again, please do speak to your healthcare provider if you're experiencing any of these side effects. Thank you for watching this video, and remember to subscribe, like, and share. And if you have suggestions for any other videos, please do enter that into the chat. Thank you.